I was still contracting at this point, even though I had delivered. Apparently, my womb is returning or going back to where it's supposed to be. So, very interesting, isn't it? I don't know why it looks like my face is swollen. My lips have gone bigger as well. Maybe it's the effect of all the medications that they've given me. I also think the induction affected my skin color. I've gone dark all of a sudden. Stop crying. Hi guys, welcome to episode 13 of my pregnancy series. This is supposed to be the labor and delivery video, and it's taking some time for me to record this video. So baby is already a big girl, so by the time I started posting out episode 1, she was already 1 year 10 months. So as I speak now, she will be 2 years 5 months in 5 days, literally. So I'm sure you can hear her then. Jaelle, stop. If you have been following from episode 1 till date and you have been leaving a comment, I've got a surprise for you, which I will announce in the comment box. So keep an eye there. And if you have not subscribed to this channel, please do your best to subscribe and also click on the notifications bell so that anytime new videos are uploaded, you will be the first to receive them. Guess what? I'll be sharing more family videos going forward, so you don't want to miss it. Yo, move away. Get out of this video. Labor and delivery. What an interesting topic and an interesting experience. So I started preparing for delivery when I was about 37 weeks. And I was really hoping to deliver by 38 weeks because I was so tired. And I know that there's a percentage of women, first-time mothers, who deliver around 38 weeks. So I was hoping that I would be among them. I was so tired and I was just ready for baby to come. But unfortunately, she decided to just stay cozy in the womb. So 38 weeks came, baby was not here. 39 weeks, baby was not here. So they started suggesting induction. And initially they wanted to do something called membrane sweep, whereby my midwife was going to literally insert her hand to, do something that apparently is going to speed up labor. And to be honest with you, that is one of the things I did not like about pregnancy at all. Anytime you go to the hospital, somebody wants to check you, they want to insert their hand through your vagina so that they can check you, and I hated it. So I was just praying that that membrane sweep will not happen. And then I got to 40 weeks. And they said, okay, we'll give it another few days. If baby doesn't come, then you would have to come and see the midwife for her to do the membrane sweep. But luckily for me, when I was 40 weeks, 3 days, I started having these contractions. And obviously, they've taught us what contractions are during the antenatal classes. But because it was during the COVID time, we did everything online. And it was just a few hours. So I thought, I understand what is contractions. I understand when I go into labor, I will know it. But when I called them, when I started contracting, they said to me that I was in pre-labor. So I need to wait. The only time I can come to the hospital is when my water break, or if I feel like the contractions are very, very frequent. They should be lasting for about at least 60 seconds and it should be happening every 5 minutes. That means that I'm really in true labor. So anyway, I started contracting, but it wasn't that frequent. So I stayed in that state for about 3 days. So I was just at home. When it comes, I would just try and pace the floor a bit. And obviously I was praying as well. So I went on YouTube, got the Tongues of Fire by Bishop David Oyedepo. And I placed my phone on my tummy. I anointed my tummy and started playing it on my tummy. And then the next day, which was the 4th day, I played it almost throughout the day. And that day I knew that I knew something was going to happen. Before I went to bed, I anointed my stomach and played the Tongues of Fire again. So literally he was just speaking in tongues in that video. So I placed it on my tummy, played it, and went to bed. And by this time, the contractions were becoming much stronger, even though they were not very, very frequent, but when they come, it was very strong. It's very difficult to explain contractions unless you've gone through it. So it comes like a wave. You feel like this building wave, and it just squeezes my belly. And remember, my belly is full with the baby, and my belly at this point was very sensitive as well. So when it squeezes like that, it comes with so much pain, and then it just squeezes and hold it for some time, and then it releases. Okay, so that's the best way I can explain contractions. So I went to bed, and whilst I was sleeping, I felt the contractions was coming. But this time around, I felt like I needed to wee. So I could feel this heavy push coming through my private parts. So it was as if I want to wee, but there was this heavy push on my bladder. I don't know how to explain it. And so I thought, okay, I'm about to wee on myself. Let me get up quickly from the bed and go to the loo. Immediately, I lifted myself up to sit. I felt this big gush of water. It just came out of my private part. It was so heavy that it just splashed on the bed. And I was like, oh, my water has broken. This is what they mean when they say your water has broken. Because honestly, even though they explained it during the antenatal, they said that sometimes it could come as a trickle. Sometimes it will come like a heavy gush. So I thought I was just going to see water come out of me, but I couldn't imagine it the way it happened, with the kind of pressure that came with the gush of the water. It was just very interesting. So I was now very happy. I was like, yay! Now I'm sure that baby is going to come out within 24 hours. So because once your water breaks, they normally will not allow the baby to be in the womb for more than 24 hours. So I was not happy. So yeah, at least within 24 hours, I'm gonna see my baby. They had a midwife line at the hospital that you can call. So I called them and they said, okay, if your water has broken, you need to start making your way to the hospital. So they told me to use maternity pads. So this is the maternity pad that I had. They've got different ones. I'll talk more about the one that I use for my postpartum in maybe another video. But this is the one, so I just use it like pad. It's a bit heavy than the normal pad. Okay. So I had a quick bath, and then I used the maternity pad, and we went to the hospital. When we got there, yes, before this, 2 weeks before I went into labor, I had what is called the bloody show. Some people call it the mucus plug. It's like a discharge. It's very similar to when you are ovulating. The discharge that comes is a little bit thicker, but this one has a little blood stains in it. And it's a bit pinky. The blood stains is a bit pinky. They normally will expect that it will be maybe a little bit brownish, not too dark and not too bloody. So it shouldn't be very fresh blood. If it's very fresh blood, it can be a cause for alarm. So initially, when I had that, I don't know if I've explained this one very well, but when I had my bloody show or my mucus plug come out, I thought that was my water. I thought that was when my water broke. So I actually called the midwife and I said, I think my water has broken. And they said, okay, describe what is happening. I described it and they said, oh no, that's not your water, that's your mucus plug or your bloody show. And I said, oh, okay, so what should I do? And they said, you have to wait until your water break. Okay. So unfortunately, because of the COVID, they suspended a lot of activities and we had to literally do a lot of self-studies. So the little antenatal class we had, I thought I understood it, but in practice, it was a little different. So when we got to the hospital, it was still dawn. They gave us a bed. We were assigned to a midwife who, made us very comfortable. And then they said they needed to check to make sure that the water that has broken, everything has come out. So guys, they now had to insert their hand into my vagina, and trust me, that thing, I hate it. And when the lady did, she said that there was still water sitting on top of the baby's head. So she has to find a way to tear the amniotic sac. She has to tear it. I don't know how to explain this better. So she has to insert her hand so that she can tear it properly for all the water to come out. And this thing, my God, it was so uncomfortable. So she did, and eventually the rest of the water. So I was so shocked because I thought the water was very small, but literally it's the amniotic fluid. That is what they call your water has broken. So that fluid, the whole of that fluid that is surrounding the baby, which the baby is lying inside for the whole 9 months, that water needs to come out. Everything needs to come out. So everything came out, and it felt very warm. The water was very warm. It was a little yellowish, and it has this sweet smell. They also had to check how many centimeters I have dilated. So when the midwife checked, I had dilated 2 centimeters. So she said, okay, you can't deliver vaginally with 2 centimeters. So we need to induce you. They are disturbing my video. Jaelle, you need to go. Stop this. It's not time to sing ABCD. I'm doing my video. I'm talking about you and then you appear. Go with that. Sorry, guys. Yeah, go. Bye. Let me continue my video. So the recommendation is you have to be 10 centimeters dilated before they can attempt delivering the baby vaginally. So 2 centimeters meant that I had to be induced, and they were going to put me on induction for 6 hours to see how far it will go. So we did induction, and trust me, that thing is not nice at all. I told myself I'm not going through induction again if in my next pregnancy I don't fully dilate. Okay. Personally, I think it's an unnecessary torture. So I'm not gonna go through that again by the grace of God. So 6 hours after, they now checked me, and I had just dilated another 1 centimeters. So it meant that it's now at 3 centimeters. And the lady was like, we have to try another induction to see if it will progress further. And I'm like, no way. This is my body. I choose what you do to it. So I said to my husband, I'm not doing it. I'm not going through this induction again. So they had to bring different doctors to come and speak to me. And in the UK, they are very good with this. You will see so many doctors all of a sudden coming. I'm like, hey, so where were you all? So the doctor came with other midwives. And then they said, okay, if I don't want to do induction again, then they said they were going to do epidural. They were going to numb me. They were going to numb me so I wouldn't feel the pain. And I asked them, so what would happen if after this, if I try induction for the second time and it doesn't work, what would happen? They said then you have to do a CS and you will have to be numbed again for the CS. So I said, so what's the point? Why should I put myself through all this, catastrophic procedures, in my opinion? So I said to the lady, the doctor, I'm willing to go through CS. So they said, okay, they will bring the CS forms for me to read and then sign. So they read all the negative stuff. You can have this, you can have that, all the risk. They read it. And then they said they will give us some time to think about it and come back. So my husband asked me, what do you want to do? What would you like to be done? So I said, I wouldn't be the first woman to go through CS, and I wouldn't be the last. So let's go through the CS. All the negative stuff will not happen to me. And she said, okay, if that's what you want, let's go for it. So we called the doctor back, and we said we're ready. So that was how they started preparing me for CS. They said in the next how many hours I shouldn't eat anything. And we were now waiting. They were monitoring me, monitoring the baby to make sure that the baby is not stressed because of the induction that we had. Baby was fine. I was fine. So because we were fine, they now were attending to other people. By this time, we're now 39 weeks and 6 days. So I was just hoping that I would deliver that day before we enter the next day. But because we were fine, they left us. They were still monitoring us, but they were attending to other people who had emergencies. So my midwife was just waiting to see when the theater will be free and ready for me. So 1 minute she would say you are number 3. Another minute she would say, oh, there was another emergency, so you are now number 5. And I was like, oh my God. So we're just sitting there. My husband was just working. He was on his laptop working. And I'm like, I wish you were the one that is doing this delivery so that I can just receive the baby, And eventually it was our turn. The theater was much free. So my midwife came, she was running, said, let's go. They wheeled me to the theater. And that was how I delivered the baby in the morning. So it was now in the morning, early in the morning, into the next day. Before we went to the hospital, our expectation was that I will have a natural birth, okay? And my husband was bragging. He said, oh, he's going to video everything. Now when we got to the theater, I don't know what happened to him. He was just sitting there praying, speaking in tongues. He didn't take a single video. He didn't take a single video. And something funny happened when we got to the theater. They have numbed me, and all of a sudden we couldn't find the doctor. The surgeon got missing. Apparently there was another emergency that she had to quickly run there and do it. So we're like, what's going on? So we had to pray. My husband was speaking in tongues, and then eventually she came. She was like, oh, I'm very sorry, I had to attend to a quick emergency. She was a young lady. I think she's probably an Indian lady. I looked straight into her eyes and I said, please take very good care of me and the baby. And she said, okay, I will do my very best. And I thanked her. So we started, and within a few minutes, baby was out crying. So they quickly showed her to me. And then the midwife had to clean her. I told my husband, please go. Make sure you are seeing everything they are doing. We couldn't do skin to skin straight away. So my husband was holding her whilst they were stitching me back. And I sat there. I looked at my baby, and she was so pretty. Her eyes were fully open. And I noticed her nice skin. I was like, oh, she's so pretty. She's got nice skin. She's got nice hair. She's got a lot of hair. And her eyes, she was just looking like, I'm like, this girl, you have come. Yeah, so by the grace of God, it was a smooth one. When the surgeon finished, when they finished stitching me, she came back to me and she said, everything is perfect. There was no complications. So we are going to wheel you back to the recovery room. And then after that, you go to the ward. I said, okay, and I thanked her. And we left. We took the baby to the ward. And they had to monitor me. Normally, they will discharge within 24 hours if everything is fine. But my pulse was high. So they kept monitoring. So I was at the hospital for another 3 days. We wanted to do breastfeeding. So whilst I was at the hospital, they were trying to help me to breastfeed. And unfortunately, my baby wouldn't latch. So all the 3 days that we're at the hospital, guess what? She couldn't eat anything. So I'm going to continue this breastfeeding story in another video. Literally what we went through from the hospital when the baby couldn't latch to what happened afterwards. And obviously when we got home, postpartum started. So that is a whole video on its own. Everything that happened in the first 3 months. I'll share that in another video. I'm recording this video on the 1st of October 2023. So our baby is almost 2 years and 5 months. You saw her briefly, but I'm going to share with you just a little of her first 1 year journey. So month by month until when she turned 1. You can't find it. It's on your head. Aha. Beautiful Jaelle. No. Uh-huh. Uh-huh. What do you say? They said my time is getting me. Mm-hmm. Yes. What do you do every day when you wake up? Yes, good girl. Yes, good girl. Want to pick the other toy? Mm?
Drumming time.
Drumming time on dining table. Yeah, Jaelle and Daddy. Da, 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 Abu, da, 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 da. The food is finished. Oh. Everybody's gone, Jaelle. Everybody's gone. We've got the drinks here. Come, Jaelle. JJ, come. What is Jaelle thinking? Do you like this place, Jaelle? It's a little bit new, isn't it? Mighty God, we give you praise, we give you praise, awesome God, awesome God. We give you praise, mighty God, mighty God. You are highly lifted up, awesome God. You are highly lifted up. So this is the end of episode 13. I hope you've really enjoyed the whole series from episode 1 till date. and you've learned a lot, please leave it in the comments. I want to feel you guys in the comments. If you're enjoying these videos, let me hear you in the comments. Hopefully my next videos, they are going to be family videos from my pregnancy journey with baby number 2 and other family stuff that we did. We'll see how it goes. I probably just be posting random videos, but it will still be touching pregnancy and other stuff that concerns starting a family and living as a family. So thank you once again for watching all my videos. Please subscribe to this channel if you haven't done that yet. Like this video, leave a comment and share with your friends. I'm currently running Effective Singleness as a series. Why some husbands do not help their wives at home. Kitchen Romance, which is my cooking series, and prayer break. So if you keep an eye on this channel, whether you are watching from Married with a Life Facebook page or YouTube channel, or from my personal YouTube channel, Peace Amewowo, you will see everything that I do with my singles and couples on that channel. And I hope to see you in my next video. God bless you. Take care. Bye.